It's me again, Catherine from Johnson Family Medical. So today we are going to be celebrating summer and the sun and our skin and how to take care of that. So I will be linking some of this information below in case you need it. And if you guys have any questions that you weren't able to submit during this live video, you can leave them in the comments and I will reach out to you. So first of all, our skin is our largest organ and it's actually a window into our health. So some of our, thyroid diseases show up as dry hair, skin, nails. Some of our rashes are autoimmune. So taking care of our skin is extremely important. And I recommend that you check your skin once a month. So what that means is you're looking for asymmetrical moles. So one side doesn't look the same as the other side. Borders that are blurry, look like watercolor. Colors that are not the same throughout. So if you have kind of like a brown to a black or just a color that's not necessarily normal, like a purple, blue, dark black, you want that looked at. You're also looking for something wider than the end of a pencil or a pencil eraser diameter. And then you also want to be looking for evolution. So new moles, new freckles, or changing moles or freckles. So I'm going to link below the ABCDE of skincare and how to do a skin assessment. I recommend doing that on a day that you pay a bill, whether it's your cell phone bill, car payment, house payment. That way you remember to do it. And the most important areas that you want to look for are the areas that you don't really think about. So if the sun doesn't shine there, there probably shouldn't be a mole there. So I want you to pay special attention to your eyelids, between your toes, your genitalia, your rectum, and make sure that nothing is where it should not be. It's good to see a dermatologist once a year and have a baseline exam. And if you have a family history of melanoma or skin cancer, it's better to go more frequently. So sunscreen is important. And I want to talk to you about what kind of sunscreen works best and does SPF really matter, etc. So candidly, SPF really does not matter that much. I believe 10 of SPF is about 90% of UVA and UVB rays, both of which can lead to inflammation and skin cancer. So if you have an SPF of 30, it covers about 90% of rays. SPF of 50 is only about 98%. So you may be paying more for an SPF that isn't actually as effective. I will say that sunscreen with zinc is important. Hi, Alma. How can you get vitamin D while quarantined? Perfect. So I'm going to get to vitamin D in just a minute, and thank you for your question. So I have a little script here, but with zinc, that's a powerful antioxidant and anti-inflammatory, and so it's also a barrier cream for the sun. So if you get a sunscreen, it's good to have zinc oxide. That being said, it's better to have a nanoparticle zinc oxide. Those typically go on clear, so you don't have that white part on the nose or the face. And the reason why that's important is because zinc oxide can actually get into the blood. There's studies that say that this could actually be disruptive to your hormones, and it's also disruptive to coral reefs in our ocean life. Certainly if you were to put that in your eye, it would burn, and so that can affect, dolphins and fish, and it bleaches the coral. So that being said, I'm going to link kind of a natural sunscreen. It's good to wear sunscreen daily and reapply it every few hours. All right, so to Alma's question, so vitamin D, I have on here, vitamin D puts the D in defense, and that's because it supports your immune system, it reduces cancer growth, it's been shown in some studies to reduce your chance of having colon polyps, and it also helps stimulate and regulate your blood pressure and insulin production. So vitamin D does a lot. It's actually the only vitamin that is synthesized from our skin. So the sun hits our skin and that actually synthesizes to the liver and creates vitamin D. However, we're in quarantine, as Alma talked about, and also we are very cautious now of extreme sun exposure and skin cancer. So in general, it's good to take a vitamin D supplement. However, check with your provider first, because sometimes we don't need to be doing that if you have a parathyroid issue. So just know that this is general advice, but I want you to check with a provider first. Typically, you need anywhere from 1,000 international units a day to 3,000 a day to actually reap the benefits of vitamin D. If you are taking a vitamin D supplement, it's good to have it with some K, so that way it absorbs in the gut and you actually get proper potency and absorption efficacy. So if you're not privy on taking pills or supplements, there's actually good dietary sources for vitamin D. So anything, salmon, cod, herring, tuna, Sardines, if you want to stomach those have good vitamin D in them, also really good omega-3 healthy fats that protect the heart. And if you're not into seafood, you can do things like mushrooms or egg yolks, broccoli, and also I have on here, steel-cut oats as well. So daily intake, like I said, should be around 1,000 international units. So if you're eating and tracking your food, you can actually log those and it'll keep track of the vitamin D. That way you know you're on track. Vitamin D is fortified in a lot of our dairy products. However, I would recommend maybe doing something like an oat milk or an almond milk because those are fortified with vitamin D with a lot less saturated fat and carbohydrates or sugars. So I'll go ahead and link a supplement below as well in case you're wanting to reference that. And in summary, skin is our biggest protector and it's good to protect our skin. So make sure you do your self-assessments, that you see your dermatologist once a year, that you're wearing sunscreen, and that you're eating healthy and taking care of yourself. Like I said, if you guys have any more questions, feel free to leave them in the comments, and I hope everyone has a beautiful Thursday. We're almost to the weekend. Okay, bye.